Hello?
Hi, Ted.
Hi, how are you?
Good. I'm Jill. I'm going to be your nurse today.
Nice to meet you, Jill.
I heard you were in the ER last night.
Yeah, it was unfortunate. I had some real bad chest pain, so.
Yeah,
Yeah.
I heard that. And they gave you some medication. You were going to bring it in today?
Yeah, that's right. Let me get it here. Yeah, I do. It's nitro.
All right.
Nitro, yeah.
So what can you tell me about the nitro? What do you know about it?
The nitro, they told me that I should put this underneath my tongue when I'm having chest pain.
Yeah.
And yeah, they told me every 5 minutes, 3 times.
Yep. Put it underneath your tongue. We're not swallowing it, right? And then
Right.
if the chest pain doesn't stop, put it underneath your tongue 5 minutes later.
Mhm.
Doesn't stop, 5 minutes later, put it underneath your tongue again.
Okay.
Doesn't stop then.
That's right.
Do you know what you do then?
They told me to call 911.
Correct.
Yeah.
And that way they can help you out.
Yeah.
And I'm not sure if you said it in the beginning, but it's also important that you sit down before
That's
you
right.
start taking it.
Yeah, I will do that.
Yeah, because it lowers your blood pressure. You might get like dizzy or fall, and we don't want that to happen.
Okay.
So.
That sounds fine.
We also have actually a couple other medications that your doctor wanted to add in.
Oh wow. All right.
And so the first medication is aspirin.
Aspirin.
Yeah. It's going to help like prevent blood clots, because when if you have a blood clot, it puts you at risk to have like a stroke or a heart attack.
All right.
And we don't want that to happen.
Okay.
And so we're going to have you take this in the evening with the other medication. We're going to
Okay.
take them both together.
Wait, so how am I going to remember all this? How many medications do I have?
Just these 3, and I know it can kind of seem overwhelming right now, but we'll get a plan set up so that you feel more comfortable by the time you go home.
Sure. All right. All right.
I just want to tell you a couple things about the aspirin. So one of the things about aspirin is it might cause bleeding. And so I'm kind of talking about, like, I have some pictures here.
Okay.
As you can see, there's like bruising.
Oh yeah, that looks bad.
So there could be bleeding like when you're brushing your teeth, like in your gums. You want to watch for that.
All right.
And in your urine, watch for bleeding. And also
All right.
in your stool, it could be like black and tarry. And so if any of these things happen, it's just important that you get in contact with your provider. Okay?
All right. All right.
All right.
Yeah, I've kind of always just had a tough time reading these, and I guess my wife can help out, but I just, I've been working on the farm a long time, so I just kind of have a hard time reading some of these things.
Yeah, I saw that in your chart, and that's okay, because we have many people that are not able to read all the labels, and that's why we kind of want to help you understand your different medications.
All right,
Explain
that'd be great. That'd be great.
Yeah.
Yeah.
All right, so your lisinopril.
Mhm.
All right, this one right here.
Okay.
And that is to lower your blood pressure. And this is one that we're also going to have you take in the evening with the aspirin. Take them together.
Okay.
We want you to take this one in the evening because it lowers your blood pressure. You can also like fall if you stand up too fast, and so we want to avoid some of that.
Okay.
Just remember that even though when you're working during the day, like on the tractors, and you're out there, just make sure you stand up like slowly, so that you know that you're not gonna fall,
Okay.
because it causes dizziness and stuff.
Okay.
The thing is though, is that the side effect that you want to watch out for is it can cause facial swelling, like where your eyes could like swell, your lips, your tongue.
Okay.
And so if you see any signs of that, that's an important time to call the provider.
Sure.
All right.
All right.
All right, and so that's your 3 meds.
Okay.
Can you tell me about each of your meds so that I can make sure I was clear when I was teaching you?
Sure. This is the lisinopril. This is the one that I take for my blood pressure.
Mm-hmm.
They said I could get lightheaded or dizzy, so I take this, sitting down or when I'm calmed down there, not doing anything. And said watch out for facial swelling.
Yeah.
This one is my aspirin, and this is the one I take with my lisinopril there. And this is the one that thins my blood so I don't have a heart attack or something like that.
Right.
You said watch out for bleeding and stuff like that. You showed me those photos there. That was helpful. So, and this one is my nitro.
Correct.
This one that I only take when I get chest pain.
Yep.
And I put that underneath my tongue, and I take that. You know, when I'm having the chest pain, I sit down and take that, and if I still have chest pain after 5 minutes,
Mm-hmm.
I'll take it again, and if I still have chest pain, take it again, and then if I need to, call 911.
If you're still having chest pain after the
Yeah.
third time? Yeah.
Yeah.
Yeah, perfect.
Yeah.
Sounds like that was clear. Do you have any questions about them?
No, I don't. That was
Okay.
good. That was good. Thank you.
Okay. The lisinopril here that you were just talking about,
Uh-huh.
you actually need to monitor your blood pressure. And
Okay.
you need to do that once a week.
How do I do that?
So I have a machine here.
Okay.
All right, we're gonna send this home with you. I heard that you don't have a blood pressure machine at home.
I don't.
Okay, and what did you just do with the, okay, so here is the paper that comes with it.
Sure.
It's a good visual, and I'm just gonna run through this with you and explain it. I know you have taken your blood pressure before, because I know I saw that in your chart where you guys had talked about it.
Yeah.
But I just wanna go over some of the main things.
Sure.
All right, so you need to sit down for
Mhm.
5 minutes.
Okay.
Not have your feet crossed.
Okay.
All right, so when you put the blood pressure cuff on,
Mhm.
right, this is gonna go straight down your hand,
Okay.
okay? And it actually shows you this in the picture, so it's just a good
Gotcha.
way to remember that.
Gotcha.
Okay? And then just push start and make sure you're sitting still.
Okay.
So you can either write it down or this can store it in there for you. Which would you prefer?
I'd rather prefer stored in there. I'm real busy, so I can't write it down too much. Yeah.
Okay.
I like that.
So just when you go to the doctor, make sure you take this with you.
Okay.
It keeps track of it. They can scroll through and they can see all your
Okay.
blood pressures.
All right. And I can have my wife help me too. if
Yeah,
I
she
have
can
it.
actually, there's one for a 1 and a 2, so you guys can both keep your blood pressures on here.
Great. That
So-
sounds great. All right.
Okay, so can you just tell me the main things about this? That way I know that I was clear when I was teaching it to you.
Sure. Yeah. You said that I should sit down for about 5 minutes and not have my legs crossed and
Mhm.
feet flat and relax and start button there and have it on my arm and have the tube lined up just like this diagram. It's real nice, by the way. And it stores them in there. Bring them to my next appointment.
Perfect.
Yeah.
All right.
Sounds pretty simple. I like that.
So we just have this, and there's just one other thing I just wanted to talk to you about here.
Sure.
It is how to take your medications.
Okay.
I know you are concerned about how to take them, how to remember them.
Mhm.
We have a couple options. This is a sorter here. You can
Okay.
separate the pills out by the days of the week
Great.
and take it.
All right.
Or, as an option, you can get them prepackaged. They come in like a sheet for the month,
Mhm.
and at the pharmacy, they'll pre-wrap them for you.
All right.
Which method would you like to use?
I'd probably like this one here. This is simple and straight to the point. I like this one.
All right, so
Okay.
let's do that. So we just need to talk about when is a good time to take your pills, and when is a good time to take your blood pressure.
Sure.
So, do you have an evening routine? That might be a good time. You want to do it like at least about a half an hour or so before you go to bed, and you need to do it with a full glass of water
Sure.
and remain upright.
Sure. Can I eat food when I take this?
You could eat it before, yeah.
Okay. Well, I usually watch TV for 2-3 hours before I go to bed.
Mm-hmm.
Yeah, so I could probably do it, half hour while I'm sitting there watching TV. I could take these and drink some water before I go to bed there.
All right, that sounds perfect.
Yeah, that sounds
Okay. And what about, when would be a good time to do your blood pressure?
blood pressure.
Well, if you do it 1 day a week, like something you do like maybe once a week, that'll help you remind you.
Gotcha. I do go to church on Sunday mornings, me and my wife,
Perfect.
so I could probably do it before then, because then I'm busy after that. so.
Yeah, that'd be perfect timing. So if you do this Sunday morning,
Okay.
once a week,
Sure,
and then this in the evenings.
sure.
And I know you're concerned when you came in that you were concerned about it being a lot of meds, hard to remember.
Was a lot.
Yeah, how are you feeling about it now?
I think I understand quite well now. It seems pretty straightforward now, especially with this. This is gonna streamline it for me, so, and you did a great job of helping me out with that, so I appreciate it.
Good. Do you have any other questions of me?
I don't, no. I think I'm pretty good, thank you.
Yeah,
Feel
you're
pretty good
welcome.
about it.
It was really nice to meet you today.
Hey, nice to meet you too. I appreciate you. Thank you.
All right.
All right.